I am here with a new topic from the Oxford Gynecology. So here we will discuss about the diameter of pelvic female pelvis. It has a great importance is during delivery. For the normal delivery, it is very important to measure the diameters. Okay, the antero posterior diameter, the horizontal diameters. Okay, so they are very important. So according to old method, there was a procedure of measuring diameters from the one crust of iliac to another iliac crust, the diameter of measurement from one spine to another spine, from one trochanter to another trochanter. So this is that about the old method. So about the new method, we will use our hand, our fingers in order to measure the shape of the pelvis and the diameters of the pelvis. So here we will discuss about something, the plane and some diameters of the female pelvis. Okay, so the diameter of the female pelvis, the female bony pelvis is not distensible, and only very minor degree of movement are possible at the pubic symphysis and the sacroiliac joint. The, the joint, that is the pubic symphysis, present anteriorly, and the iliosacral joint, which is a joint posteriorly, and it is a joint between iliac bone and the sacral bone. So this joint, these two joints, they are fibrous joint. Okay, so they will give a very limited movement, and especially these joints, they give movement during the birth time, and this movement is very important for that of the delivery. Okay, its dimensions are hence critical for normal childbirth. The diameter of the female pelvis vary at different parts of the pelvis. The true pelvis is bounded anteriorly by pubic symphysis, okay, and posteriorly by sacrum. So they say the pubic symphysis size, that is 3.5, okay, centimeter long, while posteriorly by sacrum, that is 12 centimeter long. The superior circumference of the true pelvis is the pelvic inlet, and the inferior circumference of the pelvis is the pelvic outlet. So I will draw that of the female pelvis here. For example, this is for the pubic bone. Okay, it's not a very good diagram, but I will try to make it a small one. So for example, this is your pelvis, right side, and here the sacrum, and here the pubic symphysis. Okay, anteriorly the pubic symphysis. It is not according to anatomical structure, but I draw just for understanding purposes. So we can say that from here one crust to another crust, that is the false pelvis, and that is also called as pelvic inlet. While near the perineum, this area, okay, in between the your legs inferiorly, that is the pelvic outlet. So the distances of the pelvic inlet, pelvic outlet, they are different, and in the pathway from inlet to the outlet, this is the birth canal, or can say a distance or a track through which a baby can pass. So the diameters are different at different region. The diameter is different at the pelvic inlet. The diameter is different in the midway and in the below that one, and the diameter is different at the pelvic outlet. So according to that, they divided the pelvic cavity into four planes. Okay, Number first plane, that the pelvic plane of the pelvic inlet. This is bounded anteriorly by the upper border of the pubis, laterally by the iliopectineal line, and posteriorly by the sacral promontory. So like this, okay, this is the iliac bone, the sacral bone, another iliac bone. Like this, it's not, I cannot make here properly. So this is the iliac bone, this is the sacrum bone, and this is another iliac bone, and interiorly the pubic symphysis. Okay, so the inlet is from the upper border of pubic from here. Laterally it is the iliopectineal line. Here is the line that is called as pectineal line, and posteriorly the sacrum bone here. Okay, you can understand if you know the anatomy of the female pelvis. Okay, so they said that this is bounded anteriorly by the upper border of the pubic, laterally by iliopectineal line, posteriorly by sacral promontory. Okay, so the borders are cleared. The average transverse diameter is 13.5 centimeter, and the anteroposterior diameter is 11 centimeter. So if the pelvic inlet is concerned, in that condition the transverse diameter of inlet is greater than that of the anteroposterior diameter. So the transverse diameter of a pelvic inlet is 13.5 centimeter, while that of the anteroposterior diameter is 11 centimeter. The second point, it is possible to measure these diameters clinically, and the only diameter at the pelvic inlet amenable to clinical assessment is the distance from the inferior margin of the pubic symphysis to the midpoint of the sacral promontory, which is 1.5 centimeter greater than the obstetric conjugate diameter. And the second plane, that is the plane of the greatest pelvic cavity or dimensions. So what they said, this is the roomiest part of the pelvis and has little clinical significance. This is almost round in shape with an average transverse diameter of 13.5 centimeter and an average anteroposterior diameter of 12.5 centimeter. So I start from the pelvic inlet. When I go down from pelvic inlet, I enter into another area, and that area is the largest diameter. So here they said that the transverse diameter is 13.5 centimeter and anteroposterior diameter is 12.5 centimeter. So if I come further below, okay, further down into the pelvis, what I get? That is the plane of the least pelvic dimension, which is circular in shape. So this is bounded anteriorly by the apex of the pubic arch. Okay, pubic arch is the angle that is formed between the two pubic bone, or we can say just below that of the pubic symphysis. So that is normally greater than 90 degree, but in this case the apex of the angle is the anterior border of the plane, which is least in diameter. So this is bounded anteriorly by the apex of the pubic arch, laterally by the ischial spine, and posteriorly by the tip of the sacrum. The interspinous diameter is the narrowest space in the pelvis, 10 cm, and represent the level at which impaction of the fetal head is most likely to occur. So this is the area of the female pelvis, okay, which is smallest and round in shape. So borders are cleared, and they say the interspinous. So this spine is not that of the iliac spine. this is the spine of the ischium bone. If we see interiorly inside from inner side, okay, we can see two spine of the ischium bone. So it is the distance between the two ischial spine. So the two ischial spine distance is 10 centimeter from here to here, okay. So this is the smallest from above two planes. So they said that it is the point where the impaction of the fetal head, most likely impaction mean the fetal head fixed there or and limited the normal movement of the fetus during delivery. So it causes abnormal delivery or it causes some problem during delivery. So another point is the last one, that is the plane of pelvic outlet. So the plane of the pelvic outlet is bounded anteriorly by the pubic arch, which should have a desired angle of more than 90 degree. The posterolaterally by the sacrotuberous ligament and ischial tuberosities, leading to the coccyx posteriorly. So okay, this one is the pelvic inlet. Then I come the largest diameter. Then I come the smallest diameter, which is round in shape. Then I come the pelvic outlet. So baby will pass like this, okay. So this is the whole pelvic of female. So the last one, that is the pelvic outlet. I am discussing about this one. It is bounded anteriorly by pubic arch, okay. Pubic arch is like this. So these are the two pubic bone. This is the pubic symphysis. Here this angle, and this one is the angle which should be more than 90 degree. So the pelvic outlet start from this area, okay. So there is the pubic arch. So anteriorly pubic arch, and posteriorly we can say that the coccyx bone, and laterally that is the ligament, that is the sacrotuberal ligament. So the diameter of this pelvic outlet is about 11 centimeter, and it is a distance between the two tubercle of the ischial bone. So here they said that intertuberous ligament, intertuberous diameter. So it is the diameter between one ischial tuberosity to another ischial tuberosity. So distance here we can also feel by touching from outside. So during delivery we put our hand making a fist and put in this area in order to measure the distance, and it should be more than 10 centimeter, approximately 11 centimeter. So all these about that of the plane of the pelvic cavity. Thank you.